Thanks everyone for joining today. I'm going to start by reviewing where we're at with our epidemic to the extent that we can characterize it, and some of the updates that Sharon mentioned related to pediatric vaccine and booster doses. So as of yesterday in King County, we've received reports of over 165,000 COVID-19 cases, 8,482 hospitalizations, and 2,022 deaths since the beginning of the pandemic. Over the last 7 days, we've seen an average of 369 cases reported to us each day, which is a small decrease of about 9% from last week. And this is an improvement from the 644 cases per day we were seeing in mid-August, but still much, much higher than the 57 cases per day we were seeing in late June. The 7-day incidence rate is currently still high at 121 per 100,000, but does represent a 39% decrease from our summer peak of 199 per 100,000 per week on August 11th. However, the decrease we've been seeing in case counts and the rates have been slowing over the last couple of weeks. The 7-day incidence for nearly all age groups has plateaued over the past week. And after a 2-week period of increasing incidence, the incidence among 18 to 24-year-olds has also plateaued over the past week. Currently in King County, 5 to 17-year-olds have the highest incidence rates of all groups, followed by the 18 to 49-year-old age group. Now, the vast majority of our COVID-19 cases, hospitalizations, and deaths continue to be among people who are unvaccinated. Since January 17th, 2021, 79% of cases, 89% of hospitalizations, and 86% of deaths are among people who are not fully vaccinated. So I want to say another word about youth trends, and I hope you've seen our youth dashboard, which provides really useful information on different youth age groups over time with respect to COVID incidents, hospitalizations, and also vaccination coverage. COVID-19 cases among youth have been trending down since late August, although like adults, the rates have stabilized over the past 2 weeks or so. And as I mentioned, the youth 5 to 11 years of age currently have the highest case rates in the county, which are about 159 per 100,000 over 7 days, compared with 124 per 100,000 over 7 days for the 18 to 64-year-old age group. With respect to hospitalizations, last week, 89 King County residents were hospitalized with COVID-19. That's someone hospitalized every 2 hours. After our August peak, daily hospitalizations declined through the month of December, but have been relatively stable over the past month at over twice what they were before the Delta summer surge. And as you heard the Washington State Hospital Association briefing on Monday, hospitals throughout King County and the region continue to report significant stress from high patient volumes and high acuity cases with longer patient stays. After decreasing from the summertime peak, overall COVID hospitalizations have stabilized at approximately 4 times higher than the COVID census was in early August. And statewide cases have plateaued at the level we were at during the highest peak in the winter surge. Hospitals are dealing with delayed care and seeing some of their highest levels of hospital occupancy around the state. Any decreases from COVID care are immediately consumed by trying to address delayed care from other important and potentially life-threatening health conditions. In King County, our deaths have been fluctuating, but have been overall approximately 3 to 4 deaths per day for approximately 2 months now. One death every 6 to 8 hours for approximately 2 months with not much change. Now, we've made steady progress on the vaccination front. In King County, 83% of people ages 12 and older are now fully vaccinated against COVID-19, and 88% of people 12 and older have received at least 1 dose. And that's very encouraging. 72% of all King County residents have completed the vaccine series, and we know that completion of the vaccine series is very important to receive full protection against the Delta virus. So we're about 72% of King County residents with this most important vaccination level. And I want to, again, thank everyone who's been vaccinated and everyone who's helped our King County community members be vaccinated to protect themselves, their families, their coworkers, and their communities. However, we still have work to do. There are several 100,000 King County residents over 12 years of age who are eligible and unvaccinated. And as we'll talk about in a minute, we now have about 180,000 children 5 to 11 who are newly eligible for vaccination. And that's because the CDC, Centers for Disease Control and Prevention, has recently recommended the use of Pfizer vaccine for 5 to 11-year-old children, which is something that followed the authorization by the FDA for emergency use of this vaccine for this age group. And several independent panels of experts advising those agencies found the vaccine to be safe and more than 90% effective at preventing symptomatic COVID-19. And so we're very happy to see this vaccine starting to arrive in our community. Vaccine will provide health benefits not only to our children, but to the environments in which they gather, to families, and to our community. Now, pediatric doses have begun arriving in King County at physicians' offices, at family clinics, community health centers, and some pharmacies in King County. However, we know that as with any new eligibility group, in the first couple of weeks, supplies will be tight and likely not be sufficient to meet the initial demand, and appointments will be hard to find initially. But we expect this to be a temporary problem and have plenty of doses within the next couple of weeks. But at this time, vaccine sites operated by our King County clinic and our partners do not have appointments available for children 5 to 11. We do have a wait list, however, in place for all appointments, including ages 12 and older, at our public health and partner sites. And as appointments become available, as the doses arrive, people on the wait list will receive a follow-up message inviting them to pick a time and location for their vaccination appointment. And as information becomes available about scheduling and supply, we'll share updates on kingcounty.gov/vaccine. So again, the shipping has just started from CDC this week for these pediatric vaccines. Providers may not receive shipments until next week, but we do expect to receive enough vaccine for about 48,000 children between 5 and 11 years of age. That's not almost 97,000 doses in the first week or so. And that's 48,000 children because we expect people to reserve 2 doses per child because it's a 2-dose series over 3 weeks. And we know there are about 180,000 children in this age group. So we're getting initially enough doses for about a quarter of the eligible children. And we will continue to focus our efforts on ensuring equitable access to the vaccine in all parts of King County, especially those hit hardest by the COVID-19 pandemic. Now, this vaccine is very similar to the adult vaccine, but not identical. It's the same ingredient, the same mRNA, but it's a smaller dose. It's a 10 microgram dose instead of a 30 microgram dose. And children must receive, who are 5 to 11, must receive this pediatric formulation. They cannot just get half of the adult formulation. So this is really important when you're making your appointment to understand that you need to make an appointment where the pediatric formulation is available. Now, with respect to boosters, I just want to remind people that booster doses are available and recommended for recipients of all 3 COVID vaccines in the United States currently. These vaccines have been very effective in providing important protection for most people from severe illness, hospitalization, and death from COVID-19. But the vaccine protection wanes over time, as does many of our vaccines, and a booster helps top off that immunological protection that we get from vaccination, and in particular, for people who are older, helps protect them from serious outcomes such as hospitalization. So we very much encourage everybody who's eligible for a booster to get one at this point. Please top off your protection by getting your booster dose now. We have had over 200,000 people in the county already receive a booster dot to increase their protection as of yesterday. So just to review, there is a recommendation for all recipients of the Johnson & Johnson vaccine to receive a booster dose at 2 months or later after the first dose. And people 18 years of age who received a Pfizer or Moderna vaccine should get a booster dose if they're 6 months out from their initial vaccine series and they're 65 years of age or older. or if they're 18 and older with underlying medical conditions, or 18 and older living or working in a high-risk setting, such as a school or healthcare facility, to improve your level and durability of protection against COVID-19. And we do want people to understand that people who are eligible can get a booster shot with any of the available COVID-19 vaccines, regardless of whether they received the J&J, Moderna, or Pfizer vaccine for their initial dose. And this is what some people refer to as mixing and matching COVID-19 vaccines, getting a different COVID-19 booster than the initial vaccine. For example, getting a Pfizer booster after the Moderna vaccine, or a Moderna booster after the Pfizer or after the J&J. That is perfectly acceptable. And I encourage people to use their judgment about which booster they would like to receive. But for women, particularly women who've received the J&J vaccine, I advise getting one of the mRNA vaccines because of the very rare but serious complication of thrombosis with thrombocytopenia syndrome that can happen in younger women with J&J vaccine. But for all others, getting the same booster that you received for your primary series is perfectly fine. Now, just a word about the vaccine verification policy that went into effect last week. We're about 10 days into it now. And this means that indoor service at bars, restaurants, and other indoor recreational facilities, including theaters and fitness facilities, as well as outdoor events with 500 or more people, will require proof of vaccination for anyone 12 or older. People who are unvaccinated or do not have verification of vaccine status can show proof of a negative COVID test within the last 3 days in order to gain entry. And this vaccine verification requirement is an extension of the vaccine verification policies that many restaurants and professional sports teams here in Washington State, our universities and businesses already had in place. There has been some confusion that we've heard from business owners that this order is optional or voluntary for businesses to comply with, but that's not the case. I just want to clarify this vaccine verification policy is required and not voluntary for businesses who are covered under the order. And I'm very grateful for those businesses and their staff who've been putting in the time to try and make this work in your setting. So thank you very much. And we look forward to hearing from you how it's going over time. With that, I'd like to pause and take questions, and then we can have a brief discussion about anything else that's on your mind.
Thank you so much, Dr. Duchin. And as I said earlier, can raise your hand and name of your media outlet, and we'll take your questions. So let's start with Joey Thompson. You can go ahead.
Hi, thanks for taking the question. To vaccine verification, I know it's only been a week, and previously you had mentioned it's going to start on an educational basis for businesses that are having issues complying or choosing not to. Have you heard of any that are sort of openly flouting the order and you've had to reach out, or has it been, is it too early to tell?
Well, thanks for the question. It is early, but we do want to hear, very much want to hear from businesses and others about how vaccine verification is going, what's working, what's not working. We do have a call on it, and I have not seen a summary of the types of calls that we've gotten, but I do know we've had some calls from businesses who have asked for help with implementation. We've had some calls asking for clarification about whether the policy is voluntary versus required, and it is required. And we've had some calls asking for guidance or resources, but I do think it's a little too early to judge at this point. I would like to be able to do that within a week or so, and hopefully the next time we talk, we can give you a summary of the feedback that we received, because we really do want to continually assess this policy, both with respect to its need in the context of our COVID outbreak, but also how well it's working with respect to implementation. We do have a website, kcvaxverified.com, that can provide some resources, and we also have a call line for businesses to call in. But I can't provide, a really accurate summary of where we're at right now, but hopefully after 2 weeks or so, we'll have a better picture of what's happening.
Thank you. And as other media outlets are raising their hands for a question, we'll take a couple from the community. First, Dr. Duchin, just for you to comment a little bit, I know you've been involved in ACIP, the CDC Scientific Advisory Group, and just wanted to hear a little bit more about what you learned about the risks and benefits of the pediatric vaccine from the meetings this week.
Well, this was a vaccine that was unanimously endorsed by the advisory committee members, who are independent scientists, public health and community representatives, both of the FDA and the ACIP, to the directors of those agencies. It was unanimously and robustly endorsed by the American Academy of Pediatrics, the American Academy of Family Practice, and many other professional organizations that are concerned about the health and well-being of children. We know that there's a very large number of hospitalizations that have been attributed to COVID-19 in young people. It's comparable to the number of hospitalizations that we see from influenza, even though we had all mitigation measures in place. So even with all the things we did to prevent transmission and prevent gatherings, and with schools being largely out of session, we still have the same comparable number of hospitalizations than we've seen over multiple past influenza seasons. We also know that once children are hospitalized, about a third of them require intensive care, and that there are other complications of COVID-19 in children, such as MIS-C, multi-system inflammatory syndrome, and long COVID that we're still learning about that can occur in children. And then, of course, the impacts that we've seen upon transmission in school settings, and the resulting disruption to school and other gatherings that are so important for children's development. So I think it's quite clear that this disease is a very significant one for children. There have been, approximately 94 deaths that have occurred in the 5 to 11-year age group. Children should not be dying at 5 to 11 years of age. And of course, that people may say that's a relatively small number compared to the number of adult deaths, which is true. But again, children should not be dying at that age. And COVID-19 actually has become the 8th leading cause of death for children in that age group since the pandemic started. So there's been a very broad-based recognition of the important impact that this disease has on child health. And of course, this disease now has, this vaccine has been given to millions of people within the US, over 200 million people, has an excellent safety record. It does have a very low incidence of myocarditis in young males. However, that complication is much less than the actual complications on the heart that COVID-19 causes in the same age groups in young children. You're much more likely to have a serious cardiac event from COVID-19, whereas the myocarditis that is uncommon but can occur in younger males is less complicated, and most people recover uneventfully. In the last update, 90% or so of the cardiologists caring for patients, or the cardiologists caring for these patients, reported over 90% had recovered at the time of follow-up. So the cost benefit or the risk benefit clearly very strongly favors vaccination for this age group. In addition, if you're concerned about myocarditis, it appears that that complication is less common in general in the 5 to 11-year-old age group, both from naturally occurring viruses. And we expect that it's quite likely that the adverse event that is seen in some of the older teens and young adults will be less common as well. So the risk-benefit ratio really favors vaccination, and we hope people take advantage of this, and that these children 5 to 11-year-old age group will now have the same opportunity that older children and adults have had to protect themselves from COVID-19, to protect their communities, and to help us get back to all the activities that children should be doing, and that we would want to be doing with our children as a community more quickly.
Great, thank you so much. We'll take a question now from Ranji Sinha, and let me know if I'm pronouncing that correctly. You can go ahead.
Yeah, Ranji Sinha, you close to correct. That's good enough. Dr. Duchin, I know that the school districts are launching their own vaccination sites, and Seattle has them, but you said that King County doesn't have the appointments just yet. When will these clinics and appointments be available? What should parents do in order to secure spots as the vaccine becomes more available?
Thank you, Mr. Sinha, for the question. So we do expect appointments to start becoming available today and tomorrow, more tomorrow. And right now, you can go to our website to make an appointment, but there's a waiting list. So basically, you can register and then receive a call back when the appointment is available. But I would just continue to look at our Getting Vaccinated page, King County, or actually, Kate, if you could put up the website for the meeting.
It's kingcounty.gov/vaccine.
Thank
And
you.
we've put it in there for media, and we'll put it on Facebook.
Excellent, thank you. I get it confused with the dashboard sites too frequently. So I advise parents both to check not only our King County sites, but there will be vaccines available in local pharmacies, community health centers, and some healthcare providers who are able to administer it. Primarily some of the larger practices, it has been more challenging for some of the small practices to take on the vaccination for COVID-19. So not all pediatric practices will be offering the vaccine, but we think there will be lots of availability over the coming weeks between the sites that we sponsor with our partners, our King County public health sites, the large healthcare providers, the community health clinics, and the pharmacies. So just keep looking, but understand that as with any rollout in a new age group, the demand often exceeds the supply initially, but we don't expect to see vaccine shortages.
Thank you. Jessamine McIntyre, you can go ahead.
Good morning, Dr. Duchin. I can wait for you. I'm Jessamine McIntyre with Fox 13.
Sorry, I have a little internet issue I have to deal with. Hang on one second. Okay, router was out of batteries. I needed a little recharge.
Thank you for that update. And I guess I wanted to ask more among the children's vaccine. We saw an early rush on low supply of the vaccine on the first arrival. Obviously, then we saw a severe drop off among adults after everyone became eligible 18 plus. So with the arrival of the vaccine among children 5 to 11, do you anticipate a similar trend? And how do you reach those that have continued hesitancy? Is there a different approach with parents than you had when you were encouraging people to get themselves vaccinated?
Okay, thanks, Jessamine. Those are excellent questions. So yes, we always see, the people who are, made up their minds and ready to go initially seeking vaccine upfront quickly in large numbers, while those who are a little more wait and see, or just not in a rush, or have more difficulty scheduling an appointment, over time, will be interested in accessing vaccines. So there always is a rush among the early adopters, and then the late adopters, and those who are truly unsure over time. So we do expect to see a big sort of surge in people seeking vaccine, because we know that many parents are interested in getting this vaccine for their children. I can tell you that within the healthcare providers and the pediatricians that I know, and all of the other healthcare providers who have children, they are going to be among the first in line. They want their children vaccinated. They know how severe COVID-19 can be in children. They know how disruptive it can be in children, and they want their children to have the benefit of this vaccine as they themselves have taken the benefit to be and the opportunity to be vaccinated. However, we also know that there are many, particularly with children's vaccines, who have concerns and will take a longer time to feel comfortable. So our strategy is similar to what it is for answering questions and getting people information about vaccinating themselves who are adults, and helping people make the best health decision for their child. And a lot of that, for people who are unsure, we'll focus on providing good, reliable information, and whenever possible, directing people to speak with a pediatrician or a healthcare provider who is knowledgeable about the disease and the vaccines. We understand that not everybody has a pediatrician or a healthcare provider, so we have resources, and we'll be making resources available, to the public. I know that there always is more concern about giving any sort of drug or medical procedure or vaccination to a child compared with adults. People always want to do the very best for their children and are extremely cautious, and that's very appropriate. And so over time, people who are not ready to vaccinate their children may see the benefits of this vaccine in the community, see other children benefit, other families benefit. And that is hopefully going to be something that will convince others, or at least provide them with good evidence that vaccination is a good thing to do. But we do understand, that it will take time for some people. We want to understand their concerns, address their concerns, and again, provide as much good information as possible. It's a difficult time because we know that on the internet, there are two things that can lead people to make poor decisions. One is misinformation. In other words, people unintentionally sharing information that's just wrong. And then there is disinformation. There are people who are intentionally putting bad information and scary and damaging information on the internet about vaccinations, about COVID-19. And those will be very difficult, to counteract, but not impossible. And I think people, again, need to seek out healthcare providers and trusted others who have the best interests of their children at heart. And we will do our best to try and help people do that. But it's again, with this misinformation, and particularly the disinformation, the intentional disinformation campaigns that are happening, we know this will be a challenge, and we will do what we can to counteract the disinformation and to correct the misinformation as we learn about, the experiences that parents are having and the concerns that they have.
Thank you so much. And we already received questions from kids and families in our community and addressed some of the first questions coming in. There's a blog post you can check out on Public Health Insider called Kids in the COVID-19 Vaccine. We answer questions from children and families in our community. So we'll continue to try and provide some answers as Dr. Duchin said. Let's take a question from Elise Takahama. You can go ahead.
Hey, good morning. Thanks so much for doing this. This is Elise from the Seattle Times. If there's any particular group of 5 to 11-year-olds that you'd recommend at this point that are prioritized for the shot while supplies limited in the first few weeks, or if they're all kind of in the same boat at this point. And then secondly, what, if anything, is the county doing to make sure that these early shots are distributed equitably initially?
Okay, thank you for your questions. So there is no prioritization scheme for a childhood vaccination. The supply is much better than it was when we rolled out the vaccination campaign for adults, and so we expect that over the coming weeks there will be plenty of vaccine. So any child between 5 and 11 who's eligible can seek vaccination. And again, it's very hard to predict, which children are going to have severe cases of COVID. We do know clearly that there are some risk factors that are known, obesity and other chronic diseases. But a third of children who have severe COVID are otherwise healthy. So it's not really possible to know which child's going to end up in the hospital. And because the supply is thought to be adequate, there are no recommendations for prioritization of certain children. With respect to our vaccine distribution, we use the same principles that we used for distribution of adult vaccine. We have filled all the orders from providers in South King County that we received, and we know that communities in South King County, particularly communities of color, have been most impacted by the COVID-19 outbreak, both with respect to the number of cases, that people in those communities have suffered, but also hospitalizations and deaths. And so we want to make sure that any provider that is able to provide vaccination to children in those high-risk communities can get vaccine. And we did fill all the orders that we received, but we also are working to provide other options besides healthcare providers, such as school-based clinics in South County, pharmacies in South County, and are working with partners to do special vaccination events in those areas of the county where the disease rates have been disproportionately high. So again, we will need to see, what the demand is and how the supply matches the demand with respect to where the supply is going. But we will do whatever we can to make vaccine available to communities that have disproportionately suffered from COVID-19 as quickly as possible.
Thank you. We have a question from the community about the guidance for J&J. The question is, this is the first time they've heard that a booster should happen after 2 months, that everything we've heard until now said 6 months. Can you clarify for the community?
Yeah, this is really important, that people need to understand that booster doses are recommended now. It's something that's recommended for many people who've been vaccinated with the primary series. And if you've been vaccinated with J&J, a booster dose is recommended 2 months after your J&J vaccination. That's different than if you're vaccinated with an mRNA vaccine, Pfizer or Moderna, in which case the booster dose recommendation is 6 months after your last dose of Pfizer or Moderna. So if you've been vaccinated with J&J, we encourage you to please get a booster dose 2 months or more after your vaccine. That will both increase the level of protection and the durability of your protection, particularly against severe COVID-19 infections. If you've been vaccinated with a mRNA vaccine, Pfizer or Moderna, and you're 6 months out from your last dose, and you're 65 and older, live in a long-term care facility, or 18 and older with underlying health conditions, you should seek a booster dose as soon as possible. And then some other groups who've been vaccinated with mRNA vaccines who work in congregate settings may also seek a booster dose, healthcare providers, people who work in schools and other congregate settings. So many people in our community now are recommended to receive a booster dose. Many more are even eligible for a booster dose, and we do encourage all those, especially those at high risk, the adults 65 and older, those living in long-term care facilities, to receive that booster dose.
Great, thank you. We have another question here from the community asking a little bit more about vaccine verification. And the question has to do with schools and school events, and why school events weren't required to provide vaccine verification. And I'm imagining this is referring to things like school extracurricular activities or school sports.
Yeah, school events are not covered by the vaccine verification policy. This is something that is focused on large gatherings and recreational businesses. Schools and school-related events are not required to verify vaccination under this policy.
Thank you for that. And related to schools, we had a question earlier from Igor Kais from Radio Continent, Russian radio, asking a little bit more about schools and whether now that we have an approved vaccine, an emergency youth authorization vaccine, whether schools will be requiring vaccine in Washington State.
Well, whether or not a vaccine is added to the required childhood immunization schedule for school attendance in Washington State is a matter that is decided by the State Board of Health. And the State Board of Health has criteria that they use to evaluate the disease and the vaccine, and whether that's something that should happen or not. And I don't know when or if the Washington State Board of Health will be taking this up, but there is not currently a plan to require this vaccine for school attendance in Washington State.
Great, thank you. And if there were any other follow-up questions, I know we had other media partners or media here. I'll give another moment, and then if not, we can have Dr. Duchin say some concluding comments. Great, and we're also noticing just in the Facebook chatter that it was helpful for you to clarify the status of the vaccination verification. It sounds like, yes, there was some confusion about whether that was voluntary or not. So appreciate that clarification. That was helpful.
Yeah, on that point, I also do want to remind people that, this is one piece of multiple, vaccine verification is one piece of multiple strategies we need to use in our community right now when transmission rates are so high, along with masking in indoor public locations and crowded outdoor locations. And just being mindful of the fact that, we still have a lot of COVID transmission. We still have hundreds of thousands of people who are unvaccinated, and this can put a severe strain on our healthcare system. And we are hoping and anticipating that vaccine verification and mask mandates will not be permanent and hopefully not be long-lived, but we really do need to understand where our outbreak is headed. We have a current plateau, we're heading into the winter season when respiratory infections sometimes are even more problematic. So we are constantly reassessing the need for these policies, and I'm looking forward to the time when they're no longer necessary.
Excellent, thank you. And with that, I think if you had some final words to share, that would be great.
Okay, well, thanks again, folks, for joining us this morning. We are in a better place than we were in August. However, before our Delta surge, our summertime surge, our cases, let me say this again. Compared with where we were before our summertime surge with Delta, cases today remain 3 times higher, and hospitalizations 2 times higher, and deaths 3 to 6 times higher. So although we're coming down from that serious surge, we're still much higher with respect to cases, hospitalizations, and deaths than we were before it. So too many unvaccinated people are still getting sick, being hospitalized, and dying. People need to understand that if you're not vaccinated, Delta will find you. It's just a matter of time, and it can put you at risk for severe illness. Vaccination decreases the risk for COVID infection, and more importantly, against hospitalization and death. Please remember that your risk for COVID-19 is additive. While community transmission remains high, you can take steps to further reduce your risk by paying attention to indoor air quality, ventilation and filtration, wearing a well-made mask in public spaces, and other COVID precautions. It's just not clear right now whether our outbreak is stabilizing at a relatively high level, or whether cases will further drop, or whether they will rise in the coming weeks. But the most important thing we can do is to keep individuals, families, and our community healthy by helping those who are eligible and not vaccinated to get vaccinated. And I'm very grateful that we have availability now of vaccine for children who are 5 to 11, so that they also can take advantage of the protection that so many of the rest of us have taken advantage of. And I look forward to seeing fewer cases among children in the 5 to 11-year-old age range, fewer hospitalizations, and fewer severe outcomes over time. So with that, I'd like to thank you again for joining us and look forward to talking with you again soon.